The OverStitch system was designed to bridge the gap between laparoscopy and endoscopy and enable physicians to develop new, less invasive procedures. The OverStitch system is a suturing system that provides physicians a non-invasive endoscopic approach to perform durable surgical procedures for GI defects, complications, and disease state management. The indication for use: endoscopic placement of sutures and approximation of soft tissues. The system can be used within the esophagus, stomach, and colon. Its broad range of applications include gastric bypass revision for weight regain, repair of post-surgical leaks and fistulas, closure of defects following ESD, and many more. The items needed for a case include the OverStitch system, which includes the needle driver and the anchor exchange, polypropylene or polydioxanone sutures, cinches, a tissue helix, and an Overtube. An Olympus double-channel therapeutic gastroscope is required. Depending on your procedure, additional accessories may also be required. This disposable system attaches to a dual-channel Olympus endoscope. The OverStitch system is based upon shuttling a needle between the anchor exchange and the curved needle body. The needle is first loaded onto the curved needle body. After the needle is loaded, the device is ready to take a stitch. The objectives of this video are as follows: that you are able to identify the system components and recommended accessories. You are able to set up the device on an endoscope. You will know the key suturing steps and be able to load the suture on the device. You will be able to use the tissue helix to manipulate tissue. You will understand how the cinch is loaded and deployed. You will be able to remove the device from the endoscope, and finally, have the ability to use the Overtube endoscopic access system. First, we will begin by setting up the OverStitch suturing system. First, insert the alignment tube down the therapeutic channel of the gastroscope. Hold on to the edges of the end cap with the needle driver closed and slide it till it fully covers the end of the gastroscope. Next, take the needle driver handle and point the bracket at a 90-degree angle to the handle. Position the lip of the bracket adjacent to the biopsy channels and rock the handle down to lock onto the gastroscope. At this point, you can rotate the needle driver handle in any direction. As you open and close the handle, you are controlling the motion of the needle driver. Take the anchor exchange catheter that holds the anchor and the suture and load it with the anchor. The anchor will slide into the tip of the anchor exchange catheter. Once you feel it click into place, pull back on the suture and thread it through the therapeutic channel until the suture goes beyond the end of the tower, at which point you've created a suture loop and you can close the suturing handle. Next, load the anchor onto the needle driver. Advance the anchor exchange catheter down the therapeutic channel. Once firm resistance is met, depress the blue button, and while holding the blue button down, pull the anchor exchange catheter back. Release the anchor exchange catheter and click the handle open. At this point, you're now ready to suture into tissue. To place a stitch, the device is positioned such that the curved needle arm and anchor pass through the tissue. The handle is then closed to advance the anchor through the tissue. After this, the anchor is retrieved with the anchor exchange catheter. Advance the catheter down the therapeutic channel until resistance is met. Next, brace your fingers on the biopsy valves and pull back on the anchor exchange catheter until a pop is felt. Immediately stop pulling on the catheter and squeeze the handle open to complete the stitch. Continue the loading and unloading of the anchor until the desired suturing sequence is complete. After the stitching sequence is completed, the anchor exchange is advanced and the blue button is depressed to release the anchor. Now you will grab your cinch and take the distal end of your suture and place it through the gold loop on the cinch. Pull a small portion of your suture through the gold loop. At this point, you'll pull the tab in line with the catheter, and the suture will pull through the catheter. Hand the catheter off to the clinician while holding tension on the suture. Hold counter tension on the suture, and while pushing the cinch forward, release the safety by pulling the thumb ring in an opposite direction of the forward 2 rings. Let the safety fall. Then, using 2 hands, fire the cinch. This deploys the cinch and cuts the suture simultaneously. The helix is designed to grasp and manipulate tissue. After passing the helix through the secondary channel, unsheath the helix by pressing the blue rotation knob, and then rotate the knob 3 to 4 turns clockwise. With the tissue captured, the catheter can be pulled to draw the tissue into the suturing arm. After the stitch is placed and needle arm retracted, the helix is unwound by twisting the blue knob counterclockwise with slight backward tension. This process is repeated to place additional bites with the OverStitch system. A variety of stitch patterns can be created, including interrupted or longer-running stitch patterns. The Overtube is designed to protect the esophagus and maintain insufflation during advanced endoscopic procedures. The Overtube has a 2-layer insufflation seal. Before insertion, ample lubrication is needed at the distal and proximal tip of the Overtube. The Overtube's proximal cuff is key to maintaining insufflation. The cuff is inflated by attaching a 10 cc syringe and air is injected. Note, for an EGD scope, inflate up to 10 cc's of air, and for a dual-channel scope, inflate up to 6 cc's of air. When inserting the Overtube, it must be placed over a diagnostic EGD scope or a dual-channel scope. When removing the end cap, securely grab the closed tip of the end cap and pull the device straight back off the scope without rocking the device. A towel or gauze can be placed over the tip to help grip the device. Ensure that you are not placing any pressure on the accutation cable. Last, remove the handle from the biopsy valves by rocking the handle up towards the biopsy valve.